In this week's episode, we're going to dive in to something that I get asked quite a bit by listeners and by women that I work with. And to be honest, it is a question that is in the back of my head all the time, especially in my 40s, as my body's changing, as I'm just starting to enter perimenopause. So today we have Dr. Briana Botsford, who's a naturopathic doctor, an Ironman triathlete, and owner of Flow Functional Healthcare in Edmonton, Alberta, joining us. Her personal background in sports has led her to focus on the intersection of sports medicine and women's health, supporting athletes and active folks through nutrition, lifestyle, and nutritional supplementation. She completed her undergrad education at Queen's University studying physical and health education and life sciences. She attended the Canadian College of Naturopathic Medicine to complete her designation as an ND with a focus in sports medicine. Dr. Botsford has written for the Canadian Journal of Naturopathic Medicine and has lectured with several institutions, including McMaster University, the Alberta Association of Naturopathic Doctors, and the Lewis Hole Hospital for Women. She has been featured on several podcasts discussing both sports medicine and women's health topics, including the impact of athletic nutrition on menstrual health, relative energy deficiency in sports, and maintaining athleticism in perimenopause, and more. She is a faculty member with the Confident Clinicians Club, an evidence-based platform for integrative practitioners. And we have her on the podcast today to talk all about exercise, women's cycles, and how do we know that we're doing the right thing for our body. Welcome back. I am so excited that you have joined me again in the Aligned Womb, Aligned You podcast. I'm Kate Nagai, and I am your host and womb guide on this journey. I'm here to help you to lean into the language of your menstrual cycle so that you can align yourself and awaken and activate to your womb wisdom to live the most inspired life. I am so excited to jump into this episode and to dive into today's topic. So let's get started. I'm so excited for this conversation today because I think, well, it's definitely something that's in my mind right now, going through many transitions. I used to be someone who was physically active. I did a lot of rock climbing and running, and I was always doing something. And then babies came, a rough pregnancy where I was on bed rest, and muscle definitely changed then, to then having little kids, to now being in the cusp of perimenopause. And all these questions of like fitness, hormones, what does this all mean? Because I think when you're, well, at least for me, when I was a teen and, early 20s, you're invincible. You just do all the things and you don't think about hormones and you don't think about the impact. And then all of a sudden you try to have a baby and everything comes to your forefront and all the questions of like, what's the best course of action? So I'm so excited to have you on here, Briana, for us to kind of unpack a little bit about fitness and hormones and what this means.
Yeah, there's lots. And you're right. It affects us at every phase of our lifespan, from puberty to pregnancy to perimenopause. And so it's kind of teasing out like what is the best approach to either your athleticism or just your general activity level, because we know exercise has so many benefits for health and well-being. And we don't want to ever discourage somebody from exercising. Unless, of course, it's medically necessary. But for the most part, we want to encourage people to stay active. So how do we do that in the context of maintaining our hormone health? And something that I think is really important is being able to adapt, right? And so knowing that something that served you well in your teens and 20s might not always serve you well, or might not be the thing that is best for your body in a given time of your lifespan.
Now, out of curiosity, I know we're going to get into where most of our listeners are at in their early 30s and 40s, but I'm curious, is there as big of an impact of fitness and hormones when we're looking at teens and that puberty and the first menarche? Because this is honestly when, like, I know I have a lot of clients who have children that are, I don't want to call them super athletes, but they're in 100 different activities and they're nonstop going. And then we're seeing them having an absence of period, which we know happens at the beginning of menarche anyways, that it can be erratic. But how much is fitness playing into puberty and those early years when your body's trying to establish a rhythm?
Yeah, it's a good question. And I mean, I think ultimately a lot of it has to do with energy availability. So how much calorie is available for basic life processes like hormonal health. So if we say like, oh, is it over exercising that's influencing regulation of ovulation or the regularity of a menstrual cycle, it's often like that's too narrow of a viewpoint. Like we want to look at the nutrition pieces, the nutrition of the teen or tween balanced to support healthy ovulation given their activity level. So there's that piece. And then there's the other piece of, you're right, the first few years around menarche, we don't necessarily need to panic about an irregular cycle or do any investigations. But that is a really important part of a medical history when we're looking at somebody in their 30s or 40s, really any point in their lifespan, is to find out, were you an athlete growing up? How old were you when you first had your first menstrual cycle? And did you experience any irregularities in your menstrual cycle as a teen or tween? Because that can inform sometimes what's going on later in life. Now, that doesn't mean that our activity level as a teen or tween influences our fertility later in life, but what it does mean is that what's going on hormonally at age 12 or 13 or 15 could give us some clues about what somebody's experiencing in their 30s or 40s. So, for example, somebody that's dealing with a lot of acne in their teens and tweens and starts the oral contraceptive pill, they've also had irregular cycles, but they're very athletic. We're like, okay, well, acne, irregular menstrual cycle kind of smells a little bit like PCOS, but then we say you're also highly active. So was your nutrition matching your exercise level? And, what happened in the time between that experience and then what's going on now with your menstrual experience? Acne is a big one, like that you want to look for. And I know this isn't super relevant to exercise, but nope. It's because lots of people treat it, right? With Accutane or birth control or what have you. And so it's a part that when you're in your 30s or 40s, we sometimes miss. We're like, oh, your skin looks great. So we just don't ask about it, right? But they may have had this complex history as a teen or tween that doesn't seem relevant. And I think like I see lots of teens and tweens in my practice. And so we are mostly focused on their nutrition. It's just like, are you getting enough nutrition to meet your exercise demands? And then if they are, and they're still having irregularities in their menstrual cycle, then we need to dig deeper and maybe do some lab testing or imaging. Anybody who hasn't had a period by the time they're 15, we need to do some investigations. But the first thing is looking at the nutrition. Does it match with how much they're exercising?
And nutrition is such a funny thing because, I'd always claim I eat healthy, but it's not necessarily eating healthy, as I just realized when I went to go see my naturopath about weight gain in my 40s. And the first question was enough protein. And I was like, I think I'm getting enough protein. And when we really looked at it, I was like, ooh, I'm not getting enough protein.
Yeah.
And so it's not just healthy eating, it's making sure you have all the components and enough of the components as well.
Totally. And like, as you know, teens and tweens are like, they can be picky, right?
Yeah.
So like sometimes you're like trying to brainstorm ways to get enough fuel into these kids with the foods that they like. And then there's even more complexities, especially with young women in aesthetic sport, gymnastics, cheer, synchronous swimming, like these sort of aesthetic sports, that there's a drive for thinness or like a value of a certain body type. And so sometimes we'll see very early on disordered eating patterns that can influence menstrual cycle as well.
Yeah, for sure. I know it's been a hot thing kind of showing up on social media and perhaps out in the fitness world of syncing our cycle with certain workouts. What are your thoughts on that? for somebody who's just midlife, has a regular cycle. Like, we're not looking at abnormalities here. We're just looking at the 4 phases of the cycle. Do we need to start planning our workouts? Is there benefits to that?
I think the first thing goes back to that first part of the discussion of we generally just don't want to discourage people from being active. So when we start to say, okay, well, your baseline need for activity is 150 minutes of exercise a week, right? Which is probably lower than we'd like it to be, but that's still, like, for some people, that's really not quite attainable just with our busy lifestyles. But when we start to put restrictions on the types of exercise that we can do at different phases of our menstrual cycle, I think it becomes even more complicated to try and get that 150 minutes of exercise a week. So my first instinct is always like, I mean, could it influence how we feel and how we perform? Absolutely. And we can talk about that. And we don't want to overcomplicate things that to make it scary for people to think like, oh, well, I was supposed to do a HIIT workout, or I like going to like my treadmill weights workout, but like I'm in my luteal phase, so like I need to do yoga. And it's like it becomes like this like mental gymnastics of trying to figure out what workout can I do when really we just need people to move their bodies for optimal health and well-being.
Right.
When you circle back to the like, okay, but we feel different at different times of our menstrual cycle. When I work with athletes, I'll always, if we're dealing with PMS or, you know, we're dealing with, okay, we're talking about, let's just say no PMS. We're talking about normal people having normal, regular menstrual cycles. They might say, you know, I don't feel like I perform as well in my late luteal phase. And so we talk a lot about self-talk. So is it necessary to change that workout because you might not hit a PR on a lift or a specific speed on a tempo run or something like that? It's not necessary to change the workout, but it is necessary to change what you're saying to yourself. You know, oh, I didn't hit that, or oh, I couldn't achieve that, or oh, I'm so out of shape. I'm slow. I'm whatever. Like all that negative self-talk that starts to happen. No, like we need to have compassion and we need to say, it's okay. Like you are in a different phase of your menstrual cycle, so you might feel differently. If we have the luxury of tweaking our workouts and doing different things at different times, that's fantastic. But also because I work with a lot of athletes, we haven't gotten to the point where we've periodized our training plans around the menstrual cycle, and getting the volume of training in might not be possible if we're only limiting certain types of workouts at certain times.
Yeah. I like what you just said about the mindset part, because I know for myself, trying to get back into running, which has been a few years of not running, I find that in my luteal phase, my legs feel like lead weights. It just feels like so much effort. But talking about what you're just kind of reflecting of like the mindset or thinking about it, I also know that my sleep patterns suck during my luteal phase. So sleep is probably a portion, exhaustion, motivation. Like there's a lot of that mindset of like, do I really want to do this, or am I forcing myself to do this?
Yeah. And sometimes, like in some contexts, we're going to be forcing ourselves to do it because there's a goal or something that we're trying to achieve. And sometimes we're going to have that mindset of, I didn't sleep well. My mood is meh, and maybe it's better for me to go to a yoga class or do some weights or what have you. But also like taking that goal into the context, if the goal is to run a 10K or half marathon or whatever, it's okay to still do that workout. Nothing bad happens physiologically. It just can be more difficult, right? And having that mindset and that self-talk to know like, it's okay. It's all right.
Yeah.
There's a lot of variables here.
And I think that in itself is really soothing for my nervous system, of just knowing that it's like, I am in a different phase. My body does feel different. My mind feels different. My sleep patterns are different.
Yeah.
And then just, I don't want to say it, but I guess kind of saying it, it feels like I have an excuse then, right? Like give myself a break, right?
Totally. And you have to, like, I think, I do that in the gym all the time. I'll especially like with for example, water retention, right? If you're retaining fluid leading up to your menstrual cycle, you're more bloated, you feel heavier. You go to do a chin up and you're like, ugh, last week I could do 8 of these in a row, and today I can hardly do one. And it's like, yeah, you have 5 pounds of extra fluid on you. And that's a big difference when you look at your strength to body weight ratio and things like that. And so instead of being like, oh, I'm so whatever in your head and going down these spirals, you say, okay, it's okay. Like, I'm in this luteal phase and I'm not going to be able to do 8 unbroken chin-ups or whatever.
Yeah. Yeah. I love that. Do you suggest or coach around your bleed days in particular of rest, or how do you work? Because you work with a lot of athletes. How do you work around the idea of still caring for your body during those bleed days?
Yeah. I mean, I think it's dependent on the goal. So like, cause lots of people will have like a race or an event that shows up on their period shows up on that day. And that's okay. We just have to, we can still perform quite well. From like an energetic perspective, I think what you're asking is like, how do we create space, to like rest, rejuvenate, like allow that natural process to occur. And so I think it depends on the person and the goal. If your period is showing up on race day and, we need to get out and do what needs to be done, we get out and do what needs to be done. Mm-hmm. And on the flip side, if we have the luxury of rebuilding in rest and rejuvenation and really focusing on nourishment, iron-rich foods, root vegetables, not that those are rich in iron, but just their grounding. And from that yin perspective in the Chinese medicine philosophy, trying to incorporate some of those practices is very helpful, but we don't always have that option. And I think that's where I get torn between the two different types of populations that I see, where it's like somebody who is training, I joke, like training to be awesome. Like, we're doing our exercise for our longevity, for our well-being, to be our best self. And then somebody who wants to win a half marathon or something like that. And so those are kind of two different, and they could both have the same menstrual cycle. And so it's a different season, it's a different goal. And so we kind of have to juggle what is the individual's goal. So if the individual's goal is just not just, but if it is, longevity and wellness, we can say, okay, well, maybe we have the luxury of rest and rejuvenation, gentle movement during that time.
I think I know the answer to what I'm about to ask. It's going to go back to how we started off the conversation. But amenorrhea and athletes, like, this is something that we hear a lot of. And I'm guessing what you're going to say is it comes back to nutrition once again. But I could be wrong. So your opinion on.
Yeah. And I mean, it's both. So it is, nutrition is probably the most important thing when we look at what's now called relative energy deficiency syndrome in sport. So basically, if the caloric expense, so the amount of calories that we're expending or using for exercise and like our life processes is more than what we're intaking, that can affect the hormones in our brain that talk to our ovaries, and it can lead to a lack of ovulation and a lack of menstruation. Now, when we refeed somebody, when we give them caloric adequacy or excess, so if we like give them enough calorie to meet the demands of their exercise and vital life processes, or we exceed that amount, it can take, in some cases, 6 to 12 months to have a regular menstrual cycle back. And just because there are so many parts of the system that become affected, thyroid is affected, like it's everything. And when we look at nutrition, it plays a big role, but the exercise itself sometimes does play a role. And that's hard for me to admit. I'll admit my bias. I sat in a fertility conference in like 2017 or 18 or something. And the presenter said, if you have patients that are running and they're trying to get pregnant, they just need to stop running and then they will get pregnant. And I was like, what? Like, I was livid. I was like, this is not, how can, like, based on what? Like, show me the research study. Like, you just stop running and you're magically pregnant? Like, no. So that led me down a whole research rabbit hole of figuring out, okay, is it about nutrition or is it about exercise? And the answer is it's about both, right? So if we can get some benefits and some restoration of ovulation and menstruation with just refeeding calorically alone, so not changing the exercise, not reducing the training, that side of things, there are some patients where nutrition is all that needs to be tweaked. There are also some patients where the stress of the exercise is biochemically causing not the mental emotional stress, right? Like it's the biochemical stress that's occurring that's disrupting what's going on with the ovaries and the brain and cortisol and whatnot. And so in those cases, we often do have to reduce exercise. The challenge is that we don't have like a blood test. There's no way for us to say, okay, you've presented your marathon training, you presented with no period and you're trying to be pregnant and we tested this variable and it means all we need to do for you is give you more calorie. And then we test somebody else and we're like, and for you, you have to stop training or reduce your training and we need to give you more calorie. We don't have any way to differentiate that. It's trial and error. So we just don't have the knowledge base yet to know who needs to do what. And I'll admit my bias would be to say, let's focus on nutrition first. And if we can keep you achieving your athletic goals while you're trying to conceive and carry to term, that's fantastic. I often also ask patients from a mindset perspective, what is the goal, right? If we're trying to be pregnant, do we also need to be running a marathon? Sometimes the answer is yes. Right? Oftentimes the answer is, I don't actually have to do both.
Right. I know working with so many clients in the fertility world over the years, some of them have come to me being, and I wouldn't even say super athletes, but people that just like to have physical activity as part of their lifestyle, right?
Yeah.
And particularly, I had a woman who played volleyball. It was twice a week, every week. And I remember her telling me that her IVF doctor said, if we're going to do this, you have to stop doing that. And she asked my advice on it. And I said, I see their point of view in like the extending your body and your energy levels. But at the same time, if it brings you joy and pleasure, and if you're going to go into depression, then that's also not serving, right? And so it's about finding that balancing act, right? Of what feeds our soul, what makes us feel connected to our life and our life's purpose, but then also seeing where we may just have to dial it back a bit. To like
100%.
Where do we need to take care of ourselves? And I'm sure you see the same with marathon runners and with people that are in the fertility world of just, you know, it doesn't always have to be black and white. Sometimes it is, like you said, asking the question of what's the main purpose and then how can we meet that purpose?
And most of the time when we're dealing with fertility, we're actually trying to get people to move, right? We're trying to get them to move in some way that, like you said, brings them joy, nourishes their body and their brain, and gives them the health benefits associated with exercise. Like on the whole, exercise improves fertility. It doesn't reduce it, right? When you look at the extreme scenarios, of course, you're going to find the buts, right? But when we look at it, and it's also, that also comes back to nutrition, where like on the whole, eating well, eating healthy supports fertility. And if we have disordered eating or eating disorders or caloric restriction that may be unintentional, to your point of like the protein intake, sometimes we're eating so many like vegetables and fruits that we're full on the fiber and we're just not getting enough total calorie. And that's not, they didn't try to do that. They weren't like, I'm going to restrict my calories by eating more foods that fill me up. It's I'm eating healthy. And then we're like, oh, whoops, you actually, in the context of eating healthy, you weren't eating quite enough. And now we just need to help you with that balancing act.
Are you looking for lasting safety, peace, and relaxation around money?
so that you can become a magnet for abundance and create lasting wealth? Check out Kate Northrup's Relaxed Money program. In this program, you discover the 3 pillars of making, keeping, growing, and giving relaxed money so that you can become the conduit for easeful abundance to channel through you. I have personally taken this program for a full year, and I have signed up for year 2 because it has made profound changes in my life. And when you join with my affiliate link, you also get 3 additional bonuses from me. You get a womb blessing attunement so that we can release some of that ancestral trauma that might be stored in your womb space around money. You'll get an abundance yoga nidra recording with lifetime access, and you'll get a group Zoom call with me where we'll go through how to womb map and layer in money and our journey into healing our money story through our womb wisdom. This is a must-have program, so go to the show notes and click on my link below. Let's go into a little bit about, because you mentioned it, the benefits of exercise. I think in most of our minds, we know like it helps us control weight gain. It is good for muscle strength, but really deep down inside the core of our body, what is exercise providing us?
Well, I mean, I think like philosophically, my opinion is that like we were designed to move. And I think our lifestyle is not. So I think we kind of need intentional movement to really just be in balance overall. And when you look at like the benefits of exercise, cardiovascular disease risk, bone mineral density, specifically for women, more movement in our early years, so our teens and our 20s, does reduce our risk of osteoporosis later in life. And so maintaining weight-bearing physical activity is very, very important for bone mineral density. When you look at muscle health, muscle is really like the secret sauce to maintaining your body composition. We talk about weight gain and even blood sugar control as we advance in our lifespan. Maintaining muscle mass, which needs to be done through exercise and nutrition, is the way to maintain your body composition, maintain your blood sugar levels. The more muscle that we have earlier in life, the easier it is to maintain that body composition as we advance in our lifespan. As we get older, as we advance in our lifespan, it's harder to maintain our muscle mass. And there's many reasons behind that. Chiefly for women, estrogen levels go down, and estrogen is protective for our muscle mass. And then we also have impaired protein absorption as we advance in our lifespan. And so impaired protein absorption, like at the level of the digestive system, can influence our muscle as well. And so if we're moving less and we're absorbing less protein, it's a recipe for muscle loss. And that muscle loss leads to a lower basal metabolic rate. So our basal metabolic rate is the amount of calorie that we burn if we're doing absolutely nothing, right? It's the amount of calorie that we burn at rest that our body needs to blink our eyes and to beat our heart and to do all those processes that we don't even think about. And the more muscle we have, the higher our basal metabolic rate is. And so as that muscle mass declines, we start to burn less calorie at rest, which is where we see patients that'll say, well, I haven't changed my diet and I haven't changed, nothing's gone crazy, but I'm gaining weight, or I'm doing everything just so to maintain my weight. And so that's why I say like muscle mass is the secret sauce, for longevity, and maintaining lots of our health parameters.
Well, and I'm assuming, and I don't know this for sure, but I'm assuming exercise also plays into nervous system regulation as well.
Totally.
At least for some people that especially need that extra
stress response and sleep. Like sleep is hugely influenced by our exercise, or or even just our activity level, right? The more exercise that, or the more active we are, typically the more restorative our sleep, or the better we're able to sleep. Now, sometimes you can get picky about like timing. Like if you're doing a boot camp 30 minutes before bed, that's probably not the best way to wind down. But like sometimes that's the only time you can get it in, right? Mm-hmm. But yeah, it's hugely beneficial for your nervous system, and especially for sleep. Yeah.
Now I'm curious. How does, from your point of view, from your approach, how would you shift and change workout routines for somebody going into perimenopause or preparing for closer to that transition of postmenopause? I know that I recently just bought the book. I have not read it yet, so I have no idea. But Stacy Sims' book and she has a whole different approach on how exercise affects stress levels in our body and how it has to kind of shift and change with perimenopause and menopause. Like I said, I have not opened the book yet. So,
okay. Yeah.
So, your opinion, I guess, and what you know of it, how do we have to start to think about shifting, or what do we have to change our focus when we're starting to go through that different transition when estrogen is starting to deplete?
Yeah, we really need to either focus on or prioritize strength training. And so that should usually look like lifting weights of some kind. Ideally lifting or moving something that's more than your body mass. So as soon as I grab like 20-pound dumbbells, I'm now increased my own mass for whatever movement I'm doing, if it's a squat or a press or anything like that. And so body weight exercises are still good and they can help us maintain, but they don't help us gain muscle mass, and they don't help us as much with maintaining our bone mineral density. So load needs to be applied to the body in order to gain muscle mass and maintain bone mineral density. So strength training is really like necessary. Now that can come in many different ways, right? We think about it as like, I got to go to the gym and lift weights. And yeah, like that's probably the most efficient way to do it. But we can also incorporate things like Pilates, which is a great way to use some resistance, but also the body's resistance. Yoga is still body weight bearing, and so can have some benefits for bone mineral density. Not as much benefit for like maintaining lean muscle, like it's more maintaining than gaining. But we do need to shift towards more strength training. And so even people who have loved endurance exercise like running or cycling or swimming or dance need to probably pick up something with some mass or some load in order to benefit from that exercise.
I was so amazed. This was years ago now. It was probably back in 2016 or 2017. So it's been a long time. I was taking a course with somebody who's a biomechanic mechanist. Anyways, she was talking about the studies that were happening in Australia with osteoporosis and elderly, and how the studies were happening in hospitals of bearing weight and weight training. And it was, at the time, it was so mind-blowing to me of how important weights are as we age. And to see these 80-year-old ladies picking up weights and doing their workouts, it was so inspiring. And it was like, that was my first introduction of how important weight training really is to the body. And for our longevity.
Yeah. It is. It sounds very like reductionistic or simplistic, but like really, like if you can pick up weights 2 or 3 times a week, half an hour, that is going to benefit your system. And especially like into midlife and beyond, there's a lot of concern for a lot of women about their body composition and sort of body changes. And it's not that we have to combat that. Like it's natural and normal for our bodies to change. I think we've been conditioned to think that they shouldn't, right? That's a whole other conversation, but it's okay to also want to have some control. And I think that's what a lot of people feel they lack in midlife and in perimenopause. Is they're like, everything's out of my control. Like I can't sleep and I'm gaining weight and it's like, going and picking up some weights It doesn't solve all your problems, but it solves like a couple of them. So I think, it's something that we need to start. I hope that in, 15, 20 years, I spend less energy trying to trick people into lifting weights, than I do right now. Like that's my vision.
I love it. I was watching this docuseries with a personal trainer, and she was saying during COVID, it was so interesting to see how they had to get creative to have weights in the home. And so her biggest thing was like, you have a child at home, pick up your child. Like that's 60 pounds. Like we can do this workout right now with your child. And so I think sometimes it's looking at those little things of like, how can we incorporate workouts or exercise with play, right? Like, I know for myself, I use the excuse all the time of I'm just too busy. I've got 3 kids. I running from here to there. And it's like, but there is things I could do. Like there is creative ways I can move my body in that busyness and still.
And habit stacking, like you said, like doing it with something else or somebody else, like enlisting an accountability buddy. There's lots of trainers that'll do like take home programs. So things that you can do in your own home. And then, having a friend meet you on a FaceTime call or something so that you do it together or what have you. Like there's lots of ways to get creative around it. And just prioritizing it if you can. Yeah.
Yeah. And I guess too, for myself, it's like some days I wake up and it's like the motivation's not there, but I have to remind myself that once I do it, the motivation will be there. Sometimes the hardest step is the first step.
Oh, totally. And I mean, there's motivation and there's discipline, right? And like, so your motivation is like your why, and your discipline is I just have to do it. And I always tell patients, like, if you just start, if you do 10 minutes, like set a timer for 5 minutes, 10 minutes, you'll probably get going and be like, okay, I can finish this. Right. If you don't like, and again, this could come back to the menstrual phase discussion. If you start and you're 5-10 minutes in and you're like, I'm really just not feeling it. Okay. Put it down, go do something else. Right. But like, give yourself that integrity of I committed to doing this and I'm gonna do it. And then, if it's terrible and it falls apart, okay, fine. But like, let's at least try.
I like that. I like the idea of integrity. And I think for so many of us women, when we do have multiple roles or multiple things on our plate, it's really easy for us to put ourselves last or to put activity last. It's like, that's a luxury. Where in fact, like that was one of my mind reframes that I had to do is like, no, this is for the betterment of my health. Like if I actually want to stay active with my kids as they grow older and my grandchildren, like the work has to start now and it has to be a priority. And I think that there's so many benefits when you put your body first too. Like I'm hearing it more and more in the business world too, of like body first, business second. And I think we're starting to see that the hustle culture is creating a stress response in our body, which is not serving us. And we do have a simple remedy, but it does require intention and integrity.
And I'll say to patients, like, what needs to change for you to have time to do this? Like, cause that's always the thing. It's like, I don't have time. And it's like, well, what needs to change? What do we need to outsource? What do you need to, right? Like doing some problem solving around how do we, because I agree 100%. Like it's difficult to put yourself first, so to speak. But it's also like there's something in our system, like individually, but also systematically, that needs to change. So whether it's somebody else has to put away the dishes or make the lunches or do whatever, like we can. There's always something that we can manipulate. It's just a matter of how badly do you want to manipulate it, right?
It's so true. My brain actually just this week, I think it was yesterday, we're in April, so we're getting that much closer to summer break. And I've just gotten into a routine of working out and making time for myself because everybody's in school. And I was like, but summer's coming and I don't have a child old enough to leave them at home yet. So if I do anything, I have to take them, but they're too big for strollers. And so my head was going through like all these excuses of like, I'm going to have to let go of everything this summer. When I was like, wait a minute. When the kids are home, you go on bike rides every day. Like you do stuff. And on the days that you don't, it's very easy to do it at 6 p.m. once my husband Lee comes home and just say, okay, you know what?
Yeah.
Because I haven't been able to do anything, I can do this, right?
Yeah.
So, but it was really interesting to watch my mind start to just on a drive sporadically start thinking about how I was going to have to give up myself in a
Yeah.
few months. And when I was
Yeah.
like, no, 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 like, where is this coming from?
Yeah. Yeah.
Yeah.
Well, that's a good reframe. And it goes back to that adaptation. Like life always changes. And the faster that we can like adapt and also change, because if we like cling and are like, well, I have to keep it the same, it's like that probably isn't going to work. But we also have to figure out how to get it in. And so if we can adapt, then we're going to be more consistent, I think.
Yeah, I like that. I guess before we wrap up here today, thinking about the menstrual cycle, thinking about the 4 different phases, if someone was curious of just like how exercise interacts with these different hormones, not getting rigid, not getting restrictive, but like just like a loosey-goosey, let's call it, approach to like how we can apply fitness to our cycle, what would be something that you would just put out there as like, if this is something that's your mind, this is how we could think about.
Yeah. I mean,
big question. I get it. But.
No. It's okay. What I'm going to do is I'm just going to go through the cycle, and we'll say, you know, you have in your earlier follicular phase, when estrogen's starting to come up, you're going to usually start to feel more like focused, energetic, and estrogen. And this is getting a little like picky and biochemical, but it does influence the type of fuel sources that we use when we exercise. So when estrogen is going up and to its peak at ovulation, estrogen may help us to spare amino acids. So what that means is that we're not burning as much protein. We're prioritizing using fat and carbohydrate as fuel when estrogen is higher. Now, we don't know how important this is. What that means is we don't know if we need to say, okay, well, you know, you're using more fat and carbohydrate during this phase, so you should eat more fat and carbohydrate. Like, we can't say that. We do not know, but it does influence the types of fuel that we're using. And so when we're using carbs and fats as our fuel, endurance activity is generally going to feel pretty good in our body, right? Because that's the fuel source we want to be using. On the flip side, later in the cycle, estrogen is lower, and so we may have an increase of amino acid oxidation or burning muscle. And so we want to prevent that, right? We want to make sure we have protein adequacy, but we also want to make sure that we're not, getting too picky about like, I need to eat this then and that then, and then, right? But so as estrogen starts to come up, and so in the follicular phase and into ovulation, we can start to feel pretty energetic and good in our exercise. And at ovulation, we can often have really, really great bouts of exercise and feeling quite good. That's also usually when libido goes up, testosterone goes up, right? Like, there's lots of benefits at that time. Some patients get a little bit of a I call it like mini PMS after ovulation, when estrogen will tank a little bit after ovulation. And so sometimes patients will feel kind of crummy around that time because estrogen is dipping, and then it starts to come up again, you know, at mirrors progesterone. After we've ovulated, we start to make progesterone, and progesterone being like a little bit more of like a calming anti-anxiety hormone. It also affects like sleep, and it affects water retention or fluid balance. So that can kind of change how we feel. Specifically in the luteal phase and the late luteal phase, you can have some issues with temperature regulation. And that's kind of regardless of age and stage, like, because progesterone increases our basal metabolic rate, which again is that amount of calories that we burn if we're just like laying on the couch doing nothing. It also increases our temperature. And so that can sometimes affect, you know, heat tolerance. So if you're looking at somebody who's doing like hot yoga, or maybe running a marathon in the middle of summer, like, that's just something to be aware of. It doesn't mean we change anything, but it's like, oh, interesting, I'm more sensitive to the heat today. And as you know, that can also affect sleep, right? So as we withdraw from progesterone and we get into preparing to bleed or starting to bleed, sometimes we'll get those night sweats, hot flashes, those kinds of things that can be disruptive. And so then, yeah, like your sleep pattern is off and you might not feel as well. So, I mean, the Coles notes are you probably feel your best exercising and you're like follicular to ovulation, and you might not feel so hot in the luteal phase, but you can still have some really great workouts either at any time of your menstrual cycle. Is that helpful?
That's totally helpful. That's really great. That's really great. And, I'm just going to share a little bit of what two different perspectives I learned, because I'm a yoga therapist. So, we get a lot of training in Ayurvedic medicine, but then I did take some training out of the States on traditional Chinese medicine and the yoga perspective. And I had such a hard time when I heard both of them, when I was learning about the TCM approach, because it went, I don't want to say it went against, it was just a different viewpoint than Ayurvedic of what I've been taught. Because Ayurveda was like, you rest during your period, you don't do anything. And then this TCM approach was, it's important for us to have movement, to have flow, and to have some gentle compressions just to help that uterus in contracting into releasing. And it was so hard for me for a long time of going, but I've been trained this way for so many years.
Yeah.
Then, it was really beautiful of pushing my boundaries mentally of trying to think about it, and now seeing how beneficial either or can be. And working one-on-one with people, I can see how for some people it's like, you know what, you actually need to do more restorative yoga during your bleed days. Like your nervous system is very heightened. You have lots of demand. Like maybe we just need to chill out a bit. Where there's other people that it's like, no, a little bit more compression, a little bit more flow might be nice in a gentle capacity, not to deplete the system, not to add more stress on it, but in a way just to encourage a natural process that's already happened. So I guess for anybody listening, what I'm taking from your conversation is very similar to that like learning moment that I had, is that it's not either or, it's not restrictive. It's really getting curious about the body, about your body, what you're feeling, and then just being like, well, I'm feeling this. So how can I meet that? And rather than just being like, the rules are.
Yeah, I think and the thing is, like, we all have to be open to changing our minds. I'm very willing to be convinced that there are rules, but right now I'm not convinced that there are.
Yeah.
So until, like, stay tuned, my opinion might change in 3 years, 5 years, 15 years. It probably should change because our information is going to change. But based on what we know right now, that's the best kind of advice or overview I can offer. And I think we all have to be willing to like learn and grow and accept those different points of view when it challenges us. And so, like I said, I probably will be, listening back to this or thinking about this when new research comes out and being like, okay, I was wrong.
Yeah.
But for now, this is what we know.
That's so great. As we end our call, I always like to end these calls with a womb-led tip. And I call it that, but it's a piece of advice, a little nugget of information that you would like to leave for any listeners listening to this. And because we've been talking about fitness, I guess something around fitness and women and hormone health.
Yeah. I think the most important thing to me is like that intuitive knowing, like if you think something's off, it probably is. And especially when I'm talking with athletes and active people, like they know their bodies physically pretty well and what's different at different times. And so if there's been a change or an irregularity or a missed cycle or anything that's kind of feels not quite right, like you're probably right. And so it's worth having a conversation with somebody that can help you figure out what is that thing. And so it's sort of listening to that inner wisdom and that knowing of your body as just very, very valuable. And so don't silence it.
I love that. I love that. Well, thank you so much for being on here, Briana. It was so great to have you. And I loved this conversation. It's one that I've been wanting to have for a while because it comes up often about fitness and hormones. And I think as women, we sometimes want to have a rule book. Like we want to know, we know how that we're doing it right. And so I really, really appreciate the conversation today. Friends, have you had a chance to download my new free ebook? Maybe it's not you. The Truth on PMS and How You Can Take Back Control of Your Cycle is now available. This is truly a book that I think needs to be in the hands of every woman who struggles with the second half of their menstrual cycle. So if this is you, click on the link in the show notes and download your free copy today. And remember to subscribe to this podcast and share a review if you loved this episode. Until next time, remember, womb wisdom equals connection to self, which ultimately equals inspired living.